Welcome to Chapter 10 video lecture number 4. In this video lecture, we are going to cover cardiologic tests and other various treatment procedures. So let's start off by talking about some different things that doctors can look for in blood tests to help diagnose a patient with cardiovascular diseases and disorders. Now, the first thing they tend to look at is what we call the lipid profile. The lipid profile will give 4 different readings. It's going to give you the total cholesterol level of the blood. It'll give you the triglyceride levels in the blood, and it'll also give you the different levels of the high density lipoproteins known as HDL, which you might hear as good cholesterol, and low density lipoprotein known as LDL, or you might hear it as bad cholesterol. Now, ever since I was younger, I've always heard that cholesterol is bad for you, and as I've gotten older, I started to kind of question, like, how is there a good cholesterol and a bad cholesterol if all cholesterol is bad for you? And I've started doing a lot of research to kind of come to an understanding of cholesterol and whether it is good and bad and all of that stuff. And there's a lot of myths out there that I kind of want to bust for you, so I'm going to take a little sidetrack, and I'm going to go through cholesterol so that hopefully you can understand it better and you can start educating everyone else a little better. Like for instance, HDL and LDL aren't even types of cholesterol, yet we call them good and bad cholesterol, but they're not cholesterol themselves. So let's try and get into some cholesterol information. So first, let's look at the basics of cholesterol. So what is it? Can you even answer that question? Because I couldn't for the longest time, and I bet you a lot of other people can't either. Cholesterol is actually a fat-like substance. It's considered a lipid if you remember that term from biology class. So it's kind of a mix between a fat and a hormone. So if you look at this slide, the image to the left is a fat molecule. That is a saturated fat. It has those fatty acid chains. And then if you look at the picture on the right, you see estrogen and testosterone. Those are hormones. And then the image in the middle is cholesterol. So you notice that cholesterol has the same kind of body as the hormones do. It has those 4 carbon rings, but it also contains like a fatty acid tail off of one of those carbon rings. So it's kind of the molecule is kind of a mix between a fat and a hormone, but either way, all 3 of these compounds are classified as lipids. Now, let's talk about the function of cholesterol, because I always thought its only function was to clog our arteries, but it has a lot of really important functions beyond that. I guess it's not even a function to clog your arteries, but cholesterol is vital. It's a vital component of all of your cell membranes, and I mean every single cell membrane contains cholesterol, and it is vital because it regulates how close or far apart phospholipids get. So if you remember the phospholipid bilayer from chemistry, right? Those purple circles in that diagram are phospholipids, and the brown chunks, those are cholesterol. Cholesterol is going to prevent those phospholipids from moving so far apart that the insides of the cell can start to leak out, and it's going to prevent those phospholipids from getting so close together, like when, like if you go outside when it's freezing, it prevents those phospholipids from getting so close together, basically so that our cell membranes don't freeze, and also so that our cells don't shrink every time we go outside in the cold. It's also used to make really essential molecules like hormones, which is how our body systems communicate with each other, so they are essential in order for our body to function correctly. It's also needed to make vitamin D. So when you go outside, the sunlight hits your skin, and the sunlight is going to react with cholesterol in order to make vitamin D. So we need it in order to get that vitamin D, especially, in Wisconsin when it's during the winter when it's dark for 15 hours a day. It's really important that we are able to make vitamin D when the sun is out, or it can really mess with our body functions. And lastly, it makes bile acids in your liver that go to help digest the fats in the food you eat in your digestive system. So cholesterol is really important. Now, since cholesterol is so important throughout your body, it's probably important to know that about 75% of the cholesterol that you need is actually made in your body. Your liver uses fats and sugars and proteins that your body doesn't need for energy and other uses throughout the body. And it takes that and it makes cholesterol from it. And the other 25% comes from foods that you eat, like eggs and meat and full-fat dairy products. So your body's actually making more cholesterol than you're eating. And now, because cholesterol is a fat, it can't travel alone in the bloodstream. It has to be attached to some sort of a transport molecule, and this is where HDL and LDL come in. So again, HDL and LDL are not cholesterol. They're actually transport molecules that transport cholesterol. So I want you to think of them like little taxi cars in your bloodstream. So both of these are abbreviations. HDL, which stands for high density lipoprotein, which is considered the good cholesterol, and I'm putting air quotes around that. You can't see that, but I am. It's considered good because it carries cholesterol from the food that you eat that might be in your bloodstream to your liver, where it can be removed from your bloodstream before it builds up in your arteries. An HDL count of at least 40 if you're male and at least 50 if you're female is considered to be healthy. And then LDL, or low density lipoproteins, is known as your bad cholesterol because it takes cholesterol directly to your arteries, which then can lead to atherosclerosis or that plaque buildup in your arteries. So an LDL count of about 100 or less is considered healthy for male and female. So when you get your blood test back, a doctor is going to look at your LDL and HDL levels, and they're going to be able to determine what is happening with the cholesterol that isn't being used for those vital functions throughout your body. They want to know if it's being removed safely or if it's being deposited in your arteries. Now, triglycerides, or fats, make up that other component of the lipid profile. Triglycerides act as unused calories that are stored as fat in the blood. So when you eat more calories than you burn, that causes triglycerides to build up in your bloodstream, increasing your risk for heart attacks. So triglyceride levels of about 150 or less are considered to be healthy. So added up, your entire lipid profile, which includes your HDL levels, added to your LDL levels, added to your triglycerides, should be no more than 200. If you have a number that's higher than 200, that might be reason to see your doctor about getting those numbers down. However, if your number is over 200 because you have a high HDL count, that is not considered unhealthy. Rather have more HDL versus the other three. Okay, so let's get back into the actual material for the chapter. Let's talk about some diagnostic tests that can be used to monitor and diagnose heart issues. So the first one, an electrocardiogram, which you might see abbreviated as ECG or EKG, is a record of the electrical signals of the heart. And so this term and the abbreviation are on your list. And basically what it is the doctor is going to attach, like you see in this picture, a bunch of electrodes to your chest. And they can kind of make a, if you remember from video lecture number 1, in the pictures there were those, like on graph paper, those zigzag lines that show you when the heart is beating and everything. That's what an electrocardiogram is. So when that flatlines, like in the movies, that means you're dead. That's an electrocardiogram. The second one is echocardiogram. which is also one of your words, and that is the use of ultrasound to record the heart's functioning abilities. So that is a alternative to an electrocardiogram. And the last one for this slide is a cardiac stress test. There we go, which is an exercise tolerance test that raises your heart rate and then monitors the effect of that increased heart rate on cardiac function. So this is often used to see if patients' hearts can handle exercise, either after an incident like a heart attack or surgery, or if an individual is obese and wanting to start an exercise program. So it lets them know exactly how far they can push their bodies before their heart might experience some ill effects. Some more diagnostic tests that we are going to talk about is an electron beam tomography, or EBT, which is a scan that identifies calcium deposits in a patient's arteries. That top picture there, that really detailed, it literally looks like a 3D printed heart. That is an EBT. Cardiac catheterization, there we go, is used to detect patterns of pressures and blood flows in the heart. And to do this, doctors are going to use a thin tube that they'll guide into the heart through a vein or an artery using X-ray guidance. And they can detect maybe where there's higher pressure within the heart or a lack of. And the last one I'm going to talk about in this video is a coronary angiogram, which is that bottom picture there. So during this procedure, a contrast dye is injected into the person, and then they're going to be able to take X-ray images, which they would then be able to identify any blockages in the arteries around the heart to maybe either prevent heart attacks or just to look at the risk of a heart attack. And that is the end of video lecture number 4.